I'd like to have the next presenter for pediatric dry eye, prevalence and risk factors in a hospital-based study, and Dr. Snehal will be presenting that.
Good afternoon. My topic for presentation today is dry eye in children, prevalence and risk factors in a hospital-based study. So though we assume that dry eye is a disease of the elderly, there is a rising prevalence of dry eye in the pediatric age group as well. Dr. Titial et al. In their 2018 study noted a prevalence of 7.89% of dry eye in patients less than 20 years of age. The purpose of my study is to determine the hospital-based prevalence of dry eye in children and to identify the predisposing risk factors. So in our hospital-based observational study, all children between 4 to 18 years of age with history of non-specific complaints of dryness, itching of eyes, foreign body sensation, repetitive blinking were subjected to an OSDI questionnaire as well as Schirmer's test, T-BUT, fluorescent staining of the cornea, lysamine green staining of the conjunctiva, and examination of the meibomian ducts. Dry eye was diagnosed on the basis of TOFS Deuce criteria 2017 when the OSDI score was more than 13 and any one of the aforementioned tests were positive. So we screened 1,420 children, of whom 124 had symptoms suggestive of dry eye, and the number of children positive for dry eye was 108. Male-female ratio was 2:1, and there was an urban preponderance. Seasonal allergic conjunctivitis and VKC were common predisposing factors, but the most common predisposing factor was the use of visual or digital devices in various combinations, smartphones, personal computers, and television, which were seen for at least 1 to 2 hours per day by most of the children. 96% of the children used these devices in the study. The OSDI score ranged from moderate to severe in all the patients. The test results were such that of the 104 children out of 108 had the scored less than 10 seconds on the T-BUT score, the average being around 7 seconds between both the eyes. 89 patients had more than 5 spots on the fluorescein staining of the cornea. Lysamine green and Schirmer's were normal in nearly all the patients. Most of the children spent their less time outdoors, and it was seen that the evaporative type of dry eye was seen in 100 patients and the mixed type was seen in 8 patients. So to conclude, it was seen that in our patients, 7.6% prevalence was seen in a hospital-based study, which was similar to other hospital-based and population-based studies. Mean age of presentation was 10 years and a male preponderance was seen. The urban preponderance was also seen. This could explain the excessive use of visual devices. The male preponderance could explain the excessive presence of allergic conjunctivitis in all the children. Itching and redness were the common presenting complaints, and that was again because of the presence of the allergic and VKC conjunctivitis. Most of the patients had more than one predisposing factor, visual display being common to all the patients, and reduced outdoor activity was noted. Only 4 patients had systemic associations, 3 of whom had ALL and had already undergone hematopoietic stem cell transplant, and and 1 child had JRA. It was seen that most of the patients in our study had evaporative dry eye. This could be attributed to the excessive use of visual devices, which leads to incomplete and infrequent blinking, and the presence of allergic conjunctivitis, which leads to deficient and altered mucin secretion. The fallacies in our study was that there was no control group. There was over and underestimation, could not be actually estimated because there are no agreed normative values for children for the tests as well as the questionnaires. And in conclusion, I would like to say that dry eye is not a simple disease. We should not, ignore non-specific complaints in children. We should evaluate for dry eye and look for the predisposing factors, because excessive use of visual devices can lead to progressive myopia, and poorly managed allergic conjunctivitis may lead to keratoconus. Both these diseases affect vision in the long run. So look out for the dry eye. Thank you.
I truly agree with you that this constant rubbing of the eyes because of dry eye leads to progressive myopia as well as keratoconus. My few questions to you: was Leishman green stain done in all the kids?
Yes.
So they allowed you, like?
Yes. I mean, we excluded children who were not willing to cooperate. Like when we took the consent from the parents, but if the child did not allow to evaluate at that particular moment, we did not include them.
Can I know the age group, please?
4 to 18 years.
4 to 18 years. Second question, what are the charges you are taking for evaluation of dry eye?
Nothing.
Nothing. It's a government institute.
It's a private medical college.
Medical college. Okay. Third, vitamin A you have mentioned.
Was there.
No, you have mentioned in the evaluation thing.
Yes.
Vitamin A. So, what vitamin A deficiency which lead to which type of dry eye? Evaporative or like mixed, or what kind of dry eye?
Evaporative, because of the goblet cell deficiency, and the corneas and the conjunctiva is xerotic, so it is evaporative type of.
And the second question is, vitamin D is supposed to be incorporated in this study because a lot of patients are vitamin D deficient for
Yes,
dry eye. So I think that is a small point which should be added to the study.
Actually, we have done a similar study in the residents in our hospital for vitamin D deficiency and dry eye, and it was found to be positive. We didn't do this as a part of this study. It was done in the older patients.
No, because now if you see, I think more than 70% of people are vitamin D deficient in our country. That is what my purse says. So vitamin D evaluation is a must for everyone. And if you see, you may see kids less than 10 also in vitamin D levels. So that is just astonishing when you just see the report. So that is a very important take home message, that evaluate serum vitamin D for all your dry eye patients, whether a kid, a young person or an elderly person, all of them you have to evaluate for vitamin D. Thank you.
Okay, thank you.